Hello, y'all. Today, this sketch is about Kawasaki disease, and it is occurring in the setting of a cow's farm. Cow's farm for a field trip for school children. So the farm here right now is at a rating of okay. It is not excellent yet, but it is okay. They had a lot of trouble, but it's fine. So cows okay, Cows OK farm, that is Kawasaki. Cows OK and Kawasaki. Makes sense, right? I'll repeat it a few times and you'll get it. You'll not forget it. So, moving on, starting with the pathophysiology of the disease, here, if you look at the left of the image, you have a sign that says you have mad farmers saying kings are crap. Kings are crap to remind you that CRB is a sign of inflammation, and this is an inflammatory process. You can see here that the strawberry has a crown, and that to remind you that coronary arteries are commonly affected. So, what you want to do when you have symptoms of Kawasaki, which I will discuss, you want to get an echo, echo immediately. And that is represented here by the megaphone with the sound echoing. You want to get an echocardiograph immediately, or yeah. So the signs for Kawasaki are remembered with a mnemonic: crash and burn, a fever that exceeds 5 days, and conjunctivitis, rash, adenopathy. You have strawberry tongue and hands and foot erythema and swelling. So first, to represent the fever, look at all the children right here having doing high five, so high fever for more than 5 days. That is characteristic. I mean, that is something that is in Kawasaki. And then symptoms could include strawberry tongue. Strawberry tongue right here. You see the strawberry gardens. And then you have the rash. All the children are wearing red shirts, and then to remind you of the polymorphous rash that later becomes a discriminating rash. And then all the kids are wearing white necklaces, and that to remind you of a cervical adenopathy that is in Kawasaki. And then you look at the kids wearing red sunglasses, and that to remind you of what? That to remind you of conjunctivitis that could be there as well. So on top of all of that, what we have left is, if you look at the balloons right here, the balloons are in the shapes of hands and feet, and that to remind you that hand extremities could be swollen and erythematous. So how do you diagnose Kawasaki? So it's clinical diagnosis, but once you have a strong enough suspicion, you should immediately do an echocardiograph, as seen here, and then you want to do lab work. Lab work. If you look at the bottom right of the picture, you can see that you have a plate, and then you have white chocolate. So white chocolate for white blood cells. White blood count is going to be elevated, and then platelets are also going to be elevated. You're going to have a low albumin, you're going to have high ESR and CRB. So besides that, once you have a diagnosis, how do you treat it? You treat it once you treat it with IVIG, aspirin, and monoclonal antibodies for if you have a coronary artery aneurysm. So the slide here says 3.6. How am I going to represent treatment of Kawasaki? I'm going to represent it with a 3.6 meter slide that has IV surrounding it and a mad kid saying this slide is ass. So what does it mean? So the IV, to remind you of IV immunoglobulins that you're going to administer. Once you complete it, you want to give a moderate dose aspirin for 36 hours, and that is represented by 3.6 meter slide. The kid says this slide is ass for aspirin. I'm sorry for this is the best knock I could remember, so yeah. I had to include it. So anyway, so after this period, 36 hours, if you have no fever, you want to transition to low dose aspirin and potentially discharge. You want to repeat echo again. And after that, you want to give aspirin from 6 weeks, a supply of 6 weeks with the kit. So if you look here at the bottom right corner of the image, you can see stations, six stations complete, and that is to verify that you have gone through the entire physical, and that is to remind you of the aspirin you need to take. So overall, I have talked about Kawasaki, its constellation of symptoms, crash and burn, and then I have talked about its diagnostics work, including echo and lab work, and then its treatment, which includes of IVIG, aspirin, and also you could give monoclonal antibodies, which are like such as etanercept for coronary artery aneurysm. Thank you very much. Have a good day.